Today we have a mobile unit from the Blood Connection that is here to collect convalescent plasma for patients who have recovered from COVID-19 in hopes of using that plasma ultimately for patients who are currently ill with the disease.
Yeah, I'm giving some plasma to help anyone that has it. I was even talking about, maybe if I give this to my family, maybe I could give the plasma to them, but thankfully I don't think I infected any of my family members. But yeah, anyone else, it's not just for the family, anybody else that needs it. I just want to be helpful. I think I'm really excited to be out here, yeah.
Well, that's what we're trying to find out. So the use of convalescent plasma, which means plasma from someone who has recovered from a disease, is an old idea. It's been used effectively historically and with prior coronavirus infections. So it's come back to life, of course, with the COVID-19 pandemic. And the hope is that patients who have already developed antibodies, which is in the plasma, will give patients who are currently ill that plasma, and the antibodies we provide them will help their own immune system potentially clear the virus. That is the hope, and that's what we're trying to accomplish with this process. We are using a protocol, so we're collecting information to see how best to use that tool in treating patients.
See what sticks.
Well, I think we've gotten a little more nuanced with it right now. That we certainly know some things that do work and some that don't work, but yes, we're still learning. Certainly in our area, we've been affected now for a bit, and we're learning more and more. We've had a lot of patients recover, which is great news. So I think the treatment we're providing is good. But again, we're looking for better tools all the time, and this is one tool that we would use. Well, we're giving it the antibody before it has its own ability to produce the antibody. So we're giving it a boost prior to their own native immune system developing these antibodies and fighting the virus. That's what really the purpose of it would be. It's effectively saying, here's an antibody that ultimately you will produce, but we're giving it to you sooner in the course of your infection in hopes that your native immune system would get a boost and clear the virus.